Kothary, thanks so much for joining us.
Oh, thank you, Alex, for having me again.
So one of the things that we're seeing right now is we are approaching the peak, according to data from the University of Washington. It's the same data that the federal government keeps pushing out, and they keep saying that we are just days away from the peak of this virus. What does that mean, number one, for us as a nation, but specifically for us here in Kern County?
So as a nation, unfortunately, what we expect is we expect a lot more positive cases and unfortunately a lot more people in the hospital. For Kern County, we're actually a little bit behind our surge. Los Angeles is supposed to hit their surge this Sunday. That's when their surge starts. And we're about 2 weeks behind Los Angeles. So we shouldn't see a surge quite yet, but we will still see an uprise in the positive cases.
So when you say surge, you mean not peaking. You mean they're really going to see a spike in cases?
That is absolutely correct. They're on the upswing, and they're on the steep uphill.
One of the things that we're seeing nationwide is there's been a lot of focus on New York, and especially New York City. I mean, the whole state has more cases than any other country in the world. They've really been hit hard by this. But we're also starting to see some hot spots across the country, as close as even Colorado. We're seeing hot spots in Illinois, Colorado, Michigan, and Louisiana. Is California up there? Are we getting close to becoming a hot spot?
Unfortunately, we are. We're very close. Like I said, we're supposed to start hitting a surge in Los Angeles starting this Sunday. I feel California will be a hot spot by the end of next week, early week after.
So it's kind of confusing because we talk about these peak resources. So should we not really be paying too much attention for us here in Kern County? Should we not be paying too much attention to the national curve, the spike and the peak of resources, because we need to be focusing on our own numbers?
Absolutely not. We have to pay attention to the national numbers because it's going to affect what happens in Kern County. And once again, the social distance, if we keep talking about that, is extremely, extremely important. The more we social distance, the further along the peak will be and the flatter the peak will be as well.
Where do you think, how prepared do you think we are as a state, as we prepare to, I mean, it's been pretty bad for areas like the Bay Area and in Southern California, but nothing compared to what we've seen in New York, not even close. What do you think is coming for us?
Well, the way we're preparing is we're preparing as if whatever happened in New York is going to happen in our state. So we are prepared. We've got a hospital that's opening up this week in Los Angeles. It was the old St. Vincent's Hospital. We're opening that up as a COVID hospital. So we really are preparing. There's a hospital in San Francisco that's opening up as well. I think that one's actually opened already. But we as a state are, I think, as prepared as we can be. However, we can still continue to work.
Let's talk about some encouraging news here. We heard Dr. Fauci yesterday talk about the death rate, and we've heard this number just last week. They said that the death rate across the country could be as high as 240,000 people with how we were already practicing social distancing, which of course is still just a staggering number. But he said now, because so many people have practiced social distancing and we've acted early, especially for a lot of states, they say that the national death toll could be around 60,000. Now, 60,000 cases is still a lot, but it's around the average of the flu. So have we really had to do all of these extreme measures to have this virus act as though it would be similar to the flu in regards to death toll?
So I get asked that question quite often. Do we really necessarily have to have the stay-at-home mandates, shut down businesses? I think, we actually did need to do that. I actually think if we didn't, this would have been a lot higher. I think it would have been higher than the 240,000. It just shows that our nation, the people of our nation, are really paying attention. Going from 240 down to 60,000, even though 60,000 is a large number, it is a dramatic difference. So I think we have to give credit to our people of our nation practicing the stuff that we've been saying to practice.
We keep hearing businesses talk about, they're extending their closures, and there was hope to open up maybe at the end of this month or the beginning of next month, but we keep seeing that date pushed back further. Just overnight, we heard even Universal Studios said that they're going to be closed until May 31st. That's the earliest. When do you think we could get back to normal?
It's very hard to say. So we talk about this spike in the surge. Well, it's a bell-shaped curve. So it's going to take us just as long to go up as it is to come back down. So it's going to take a while. So I think May 31st is still very conservative. I would push it out till sometime in June. I'd say mid-June. But that would be speculation on my part, of course.
One of the things that we've seen from Public Health every Friday, so we're supposed to get another update today, they are releasing information on how many people are considered non-infectious. They have crossed that threshold of being in quarantine for more than 2 weeks, and so the risk of spreading the virus, they say, is low. So right now we know that there are at least 33 people in Kern County that are considered non-infectious. We hear that number, and we also have been talking about people participating in plasma donations to see if they can help out with helping people who are currently going through this crisis in the fight of fighting COVID-19. What is your message to people in possibly donating plasma to help others?
So we're actually very fortunate to be partnering with Houchin Blood Bank to be able to do this. And what we're asking for currently is if you've had a positive test and you are now asymptomatic, and we're actually asking for being asymptomatic for a month, we would like you to come donate plasma, because that is potentially life-saving for us right now. There was a study done in China where they gave really critically ill patients this plasma, and this is the one thing that truly seemed to help. So if any of you would like to donate, and you've been a month out without symptoms, please contact Houchin Blood Bank.
So that means that there could be people in the coming weeks that meet that threshold of being asymptomatic for a month. So you expect people to possibly, who would be eligible to do this soon?
Yeah, absolutely. I think we already have some eligible, a handful, but I think you're absolutely right. In the next few weeks, we should see a lot more. So we're seeking out these people to help the community, really.
All right, Dr. Kothary, thanks so much for joining us this morning. We do appreciate it, and you will be back with us on Monday morning to give us an update on the crisis here in Kern County. Thanks so much, Dr. Kothary.
Absolutely. Thank you very much, Alex.